Hello everyone, my name is Nadia Jones and I am a nursing student at Indiana State University's LPN to BSN program. This health education program is for Nursing 444 Community Health. Body art, the risks of tattooing. Before we get started, please take a moment to pause this video and access the pre-test link featured in the video description below. Learning objectives. By the end of this presentation, all participants will be able to define tattooing, identify current safety measures in the law already in place, explain the risks associated with tattooing, identify patients who should avoid getting a tattoo, and report how to use nursing interventions and cultural sensitivity to care for a patient with tattoos. After completion of this course, all participants should be able to pass the post-test. What is tattooing? Tattooing is a form of body art which uses ink to create permanent images or words on the skin. Tattoo ink is considered a cosmetic, therefore tattoos are classified under cosmetology. Tattoo inks consist of inorganic and synthetic organic pigments and dilutants and often contain metal salts such as aluminum, cadmium, chromium, cobalt, iron, mercury, nickel, silicone, or titanium. The process for tattooing usually involves antiseptic cleansing of the skin, ointment application, and pigment placement in the dermis several meters down using a motorized machine that holds a needle dipped in ink to add color. According to Brunner and Levine, tattooing dates back to 2000 BC. Furthermore, there are more than 50 known tattooing pigments. Current legislation. In the United States, most states have laws in place to prevent adolescents from getting a tattoo without parental consent. The exceptions include Nevada, which has no laws in place about tattoo recipient age, and Maryland, which has limited regulations. Several states also have safety laws in place to ensure proper sanitation and licensure of tattoo artists. The governor of Georgia, for instance, just signed Senate Bill 214 to enforce statewide body art regulations. Pigments in tattoo ink may be subject to pre-market approval by the Federal Food, Drug, and Cosmetic Act, but the FDA rarely regulates it because local jurisdictions often take control of it. Although color additives are approved for topical cosmetics, the ones used in tattoos are not. According to the FDA, some pigments used are industrial grade, primarily used in printer ink and car paint. Adverse reactions to tattoo ink are supposed to be reported to the FDA. Between 2003 and 2004, 150 adverse reactions to specific pigment shades were reporting, leading to a voluntary recall in 2004. In 2012, multiple reports of infections related to contaminated ink led to a voluntary recall in 2017. Risks involved with tattooing. According to the FDA, risks involved with tattooing include infections, removal problems, allergic reactions, granulomas, keloid formations, and MRI complications. Infection. Most tattoo professionals adhere to sterile technique, but problems occur when artists are not properly trained, lack proper equipment, and/or try to reuse single-use items. Using unsterile equipment or needles can cause the spread of hepatitis, HIV, or bacterial skin infections such as Staphylococcus aureus. Infections typically present 4 to 22 days after tattoo placement and range from cellulitis, pustules, and abscesses to endocarditis, non-tuberculous mycobacteria, and gangrene. Furthermore, if an unregulated tattoo artist or facility is used, the tattoo recipient may not be allowed to give blood or plasma for 1 year. Infections can also be caused by contaminated ink. Serious infections may present as high fevers, chills, sweats, and shaking. Patients who are immunocompromised, have congenital heart disease, or live with diabetes are at increased risk for infection. Therefore, tattooing is not recommended. Additionally, the use of blood thinners increases bleeding risks during the tattoo process. Patients with psoriasis, systemic lupus, and sarcoidosis are at risk for developing lesions at the tattoo site. Removal problems. Another risk associated with tattooing pertains to the tattoo removal process. Side effects of tattoo removal include redness, bruising, tenderness, swelling, and scabbing. Depending on the size, color, and design, laser technology usually requires between 1 to 10 expensive and potentially painful treatments separated by 6-week time periods that may lead to scarring. Laser treatments are the most common technique used to remove tattoos and use concentrated light waves to fragment ink particles using heat so that the immune system can remove the tattoo. Other options include chemical peel tattoo removal, surgical dermabrasion tattoo removal, and surgical excision tattoo removal, all of which aim to remove the outer layers of skin that contain ink particles and will result in an open wound that will require time to heal. Allergic reactions. Although rare, tattoos can cause allergic reactions. According to Sullivan, types of allergic reactions associated with tattoos include acute inflammatory allergic reactions, contact dermatitis, granulomas, photosensitivity reactions, and lichenoid allergic reactions. Acute inflammatory allergic reactions present as redness with slight swelling. Although they may lead to more serious reactions, they often subside in a few weeks. Contact dermatitis is the most common type of reaction and often occurs with red ink. It may present as crusting, weeping, redness, and itching. Symptoms usually resolve in days or weeks, but may require corticosteroids. Granulomas are small bumps that form on or around the tattoo site. Photosensitivity reactions are triggered by sunlight and often occur with yellow pigments. Symptoms include swelling, crusting, itch, and redness. Lichenoid allergic reactions are small ink bumps that form where red ink is placed. Granulomas and keloid formation. The human body may also perceive the tattoo pigment as a foreign invader, which may cause a granuloma or nodule to form at the tattoo site. Furthermore, patients who are prone to scars are at risk for keloids, which are overgrown scars, after tattoo placement or after tattoo removal. MRI complications. Although getting an MRI is usually painless, tattoos have a potential to react with the magnetic waves in MRIs. According to the FDA, some people complain of a temporary burning sensation or swelling at the tattoo site during an MRI. The pigment in tattoo also has the potential to interfere with MRI imaging and can cause magnetic hysteresis as well. As an example, permanent eyeliner can impair an MRI of the eye. Tattoo pigments, especially darker ones, can act as an electrical heat conductor, so medical professionals performing an MRI on a patient with tattoos needs to monitor for signs of a second-degree burn for 48 hours post-procedure. The FDA encourages patients to inform radiologists of all tattoos to evaluate the risks and benefits before undergoing an MRI. Nursing implications for patients with tattoos. During admission, nurses should ask patients about body art, noting size and location. Tattoos may be in areas not typically visible in everyday attire. In some cultures, it may be considered rude to ask about the decision to choose a specific tattoo or location. It is important for nurses to put personal beliefs and feelings about tattoos aside in order to provide professional care that fosters a trusting nurse-patient relationship. It is important to note that tattoos can mask the early warning signs of conditions like skin cancer, so it is important to carefully inspect the skin for changes. Metal salts, although not heavily concentrated in tattoo ink, are an emerging carcinogen. If you have any more questions about this topic, please look at the references below. Thank you. Now please take a moment to pause this video once again and access the post-test and brochure in the description link below.